bringing news that matters to you. You're watching the Bahamas Tonight Northern Edition.
Welcome back. The Grand Bahama Health Services Nursing Administration Department opened the activities of Nurses Month by attending the St. Peter Baptist Church in West End. Bringing light to the importance of nurses, their compassion, commitment, and care for their patients was Reverend Jane Wilshcombe.
Nurses, there's so many people out there depending on you. You might not even realize it, but there are so many people who look up to you, who depend on you just to give them a word of encouragement. I mean, it's a full-time ministry if you take advantage of it. Sometimes you're in the hospital, the only person that you have are the doctors and the nurses. My God. So it's so important. Sometimes it's just a smile that can make someone's day.
Reverend Wilshcombe pointed to the theme this year, Nurses, A Voice to Lead, achieving the Sustainable Development Goals and having to go through the process.
How many of you know, in order to get to your promise, you got to go through the process. You got to go through the process. I'm sure nurses know that when you are sick, there's certain medication that you have to take. And there's some people who feel like, I don't need no medicine, but I don't want the medicine. But I can hear the nurses saying, you need this in order to make this situation better. You need this in order for the body to get well. So it's just like life. It's a process. In order to get to the promise, you got to go through the process. And guess what? In the process, God is with us.
And now it is time to ask the doctor.
Hi, and welcome. Nikki from Freeport asks this question. Hi, Dr. Pratt. I'm 25 years old and I play sports. Sometimes I get chest pain when I am done. Is this just sore muscles or is it something more serious like my heart? Thanks for your question, Nikki. Even though it may just be sore muscles in your chest, what we call costochondritis, chest pains of any sort, despite one's age or gender, should always be taken seriously. There's one condition that I would like to discuss that can often cause or present as chest pain in young females. This is called mitral valve prolapse, or MVP for short. When your heart pumps, blood flows from one part to the other or in and out of the heart through openings called heart valves. Sometimes a part of the valve can get leaky or floppy and may not close smoothly. If severe enough, MVP may cause symptoms such as chest pain, fatigue, dizziness, shortness of breath with activity or when lying flat, or palpitations, which is the sensation that your heart is beating fast or pounding. In most cases of MVP, does not cause symptoms, and because of this, it can go undetected and may only be discovered during a routine physical exam. I suggest you see a doctor right away to determine the cause of your chest pain and whether heart testing and treatment are necessary. I'm Dr. Monique Pratt, and this has been Ask the Doctor.
Stay with us. Ricardo Liborn is a check on sports when we come back.